The 89th Annual Meeting of the American Academy of Periodontology in conjunction with the Japanese Society of Periodontology. Special Session, Vision to Reality.
Welcome back, and I really hate to break the festivities, but the program you're about to see is tremendous, and I want you really to have the opportunity to enjoy it, and I don't want us to run short of time constraints. While everybody's getting seated, today's presenters, Dr. Michael K. McGuire and Dr. Kenneth Kornman, do not need us to recite their resumes. And the other thing is, when you see this presentation, I want you to think about the hours and hours of work that went into this and the effort that they put into this on our behalf. So would you please get seated so that we can begin, because I think you're going to enjoy this. And those of you who are out in the forum, don't be afraid to come in. We don't bite. There's a lot of seats at the tables that are a lot closer with better visibility, and you don't have to get around people. So that we don't run out of time, I'm actually going to begin. We launched the 2020 vision in New Orleans, as we stated before, but the vision is not a vision for just the Academy. It's a vision for periodontics. It's a vision for all of you, for myself, for Dr. McGuire, Dr. Kornman, all of us in periodontology. And a vision is a willingness to create a new vision, is a statement in your belief in your potential, a willingness to change, a willingness to step forward. It presents the opportunity that you can identify who you are and what you want to be through our vision. Now, a few minutes ago, I talked about the 5 goals of the vision for periodontology. But here this morning, we're really not talking about dental education. And we're really not talking about our partnership with industry. And we're really not talking about ways that we can optimize our influence. We're talking about how all of us in periodontics can really focus our practices and our lives on the 2 visions related to clinical therapy. That we'll be the premier providers of care for patients with severe periodontal diseases and periodontal conditions related to systemic health. And that we'll be the premier providers of oral plastic surgery, regeneration, tissue engineering, and implants. You remember our mission: advancing oral health and well-being through expertise in implants, periodontal medicine, and oral plastic surgery. And that oral plastic surgery itself defines the refined manipulations of soft tissue and bone within the oral cavity performed to enhance aesthetics and function, distinguishing the distinct clinical skills of the periodontist. And under these goals, remember that when we're the premier provider of these services, there's a few little statements, and there's a couple I would like to highlight. What does this mean? It means that general dentists and dental hygienists will evaluate, treatment plan, and manage most slight to moderate diseases, periodontal disease. I realize a lot of us have trouble with the moderate disease part of this. But guess what? Trains left the station. They're already treating early disease, and in 20 years, by all likelihood, our observation, not our endorsement, is that they'll be treating a lot of the moderate disease. It's up to us to educate them on how to evaluate these patients and refer patients with severe disease and susceptible patients who are genetically susceptible to these diseases to the periodontist. We will be treating these patients that have periodontal disease related to systemic health. That's happening today, and I think we can continue to strengthen that. This also means that we will get increased referrals for these conditions. It means that we will collaborate more with medicine in the future on patient care and research. And medical protocols may well include periodontal evaluation and management by the periodontist. It means improved systemic health for our patients. If we look at the other goal, that we be the premier providers of oral plastic surgery, regeneration, tissue engineering, and implants. What does this mean? It means increased practice time dedicated to advanced surgical procedures. We want to be the first choice for referrals for these patients. We want patients to self-refer. That goes back to raising your standards, raising the bar, and communicating and being identified that you can do these procedures well, better than anyone. So all those means that periodontal specialty programs will have to focus on the complete surgical scope of the specialty and on the newer and emerging areas. We're going to expand. As you change, as you leave old things, you move on to new things. It expands your horizons. It can mean increased financial success. So the door is open to your future. And I welcome you. With you, I welcome Drs. McGuire and Kornman to give us a glimpse of your future and excite your passion for periodontics. Gentlemen.
Thank you, Gordon. I have a very vivid memory from a discussion in the early 1980s with a colleague, and it was a striking discussion that has stuck with me. He said, "You know, periodontics has become boring. I tell most of my patients exactly the same thing. My hygienist could treat a lot of these cases with minimal involvement on my part. The surgery has become routine, and I don't really feel great about taking young, promising dentists in school and recommending the specialty." I have to tell you, I really didn't know what to say at that point. I was starting to become aware of some new science and technology that I thought had the opportunity and the potential to change the profession, but we all know how uncertain that story is. And at that time, many of us were aware of the fact that this statement, 70% of the adult population has periodontal disease, was true only if we were talking about simple gingivitis. But 20 years later, things have changed dramatically. Successful implants are now routine. There are regenerative membranes and biologics. We have prescription drugs for modulating the host response. We can talk to our patients about genetic risk factors and about the association between periodontal disease and systemic disorders. This truly is a different profession. Now, we are the primary group responsible, and I hope will remain responsible, for retaining the healthy, functioning, aesthetic dentition and the natural dentition. But the profession is dramatically different. And I would say, and I hope you will agree at the end of this presentation, the future is truly spectacular. Well, what does that future look like? We could sit on the beaches and speculate about what that future might be, but at some point in time, we have to get off of the lounge chairs and start blazing a trail towards that future. And those paths may take a variety of courses and use a variety of transportation modes, including some which do not currently exist. And if we're fortunate enough to pick the right path, we know from past experience there are very likely to be a host of road hazards along the way. And we may be traveling by boat one day, foot another day, and some days by new modes of transportation. And at some point along this path and along this exercise, as the consultants and the futurists are making their predictions with absolutely no skin in the game except yours, we may start to hear a noise rising in the background. And just before our brain registers the identity of that noise, we get a cramping sensation in our gut. Yes, the reality is the risk here in terms of thinking about the future is not so much starting down the wrong path and having to make a change or investing in some technology that ends up in the closet. The real risk is the waterfalls. And Juan Enriquez at the Harvard Business School warned us about this. He said that some of you will know immediately how to navigate the rivers. Others will float along somewhat placidly and comfortably until the waters get rough and suddenly the bottom disappears. And this happens to entire institutions and even countries, especially those that choose to paddle desperately against that change. They disappear. They become irrelevant. So how do we avoid those waterfalls? Well, planning for the future has the vision of this wonderful opportunity, but we all know in our gut it's a scary exercise with a lot of risk and a lot of uncertainty. And it's not unlike being dropped alone into one of the great jungles of the world. We know, first of all, it's a 10-year journey. Please understand that. This is not next year. Planning for the future is a 10-year journey. You know there are guideposts and milestones out there somewhere, but you don't know where they are. You have no compass, and your food and water are limited. And this is where you are. However, there are guidance technologies. There are experts who know how to read the trails and can guide you through the jungles. Mike and I invite you this morning to share some of what the Academy has learned as it started blazing trails to the future and trails through the jungles. Please understand, there are changes. They're not comfortable in some cases, but the Academy has brought in the experts and brought in the technologies. And the most important point is there is no reason to attempt this alone. Well, anytime we attempt to think about the future, we know how risky that is, especially if someone starts to speculate about the waterfalls, the revolutionary changes. We're very, very poor at making those predictions. For example, the changes that run through society and business for many, many years with a breakthrough like the computer chip. On the other hand, these do not come from nowhere. The breakthrough technologies start as seeds that are planted several years before, and they're growing. And we either did not stop to look for them, or we saw them and did not stop to figure out how they might impact on us in the future, in the important parts of our life. I want to emphasize we're not talking about reading crystal balls. We're talking about looking at things that exist now, current trends, current technologies in one form or another. This is not guessing about the future. It's examining what is here today. And here's what we know. Your practice will be different. And it will be different for three primary reasons. First of all, your patients already are different. The patients presenting to your office started changing more than 10 years ago, and that change is actually accelerating. In addition, the patients that walk into your practice today and in the future have different expectations. And those expectations are different because community attitudes about health, wellness, the delivery of care, and the role of the oral cavity are changing. And finally, of course, there are new technologies, not future Star Wars technology, but technologies that exist today in some form that will change your capabilities and change your services. So let's look at the patients initially. Well, we all know the demographic story, and I'm not going to discuss that in any depth. We've been told that our patients will be older, and in spite of Wall Street corrections, the patients in general will have more disposable income in the future. But in addition, we know today that severe generalized periodontitis exists in about 8 to 12% of the population, the adult population, in essentially all industrialized countries in the world. And because of the generalized improvement in oral hygiene in these countries, this severe disease is now localized in very specific, very well-defined subsets of the population that we can identify today using either biologic risk factors or, unfortunately, there are still some socioeconomic issues related to where those populations are found. And the majority of periodontal disease, mild disease and moderate disease, is now and will increasingly be managed in the general practice environment. Besides the referral of the upper end of moderate and the severe generalized cases and the implant cases, we may start to see some change in the criteria for referring cases. And this, for example, may relate to the risk for systemic disease. And it's absolutely reasonable to expect that some, not all, and maybe not even many, but some physicians in your community will start to do similar referrals. And the patients that walk in your door will have different expectations. Those expectations will be different because community attitudes are vastly different today than 20 years ago and are changing dramatically. Part of that is a result of the fact that the majority of your potential patients, not the patients in your practice today, but the potential patients in the community who may need your services, have access to information through the internet that we could not even imagine 20 years ago. In fact, today, most of the current scientific literature in periodontal area and periodontal disease and therapy is accessible electronically to your patients.
And like most things in life, too much of anything can sometimes be bad. All of this information will likely lead to confusion, both confusion inside our profession and confusion outside our profession. Confusion because of information overload, confusion because who do we really believe in this process? You and I will have to be better communicators than ever before, better communicators with our patients, with our referral sources, and the public. The positive side of all this information is that bioinformatics will give us important pieces to the puzzle regarding health, regarding disease. Our practices will become even more evidence-based than they are today. Outcome assessments will tell us which procedures work best, which techniques are best, which materials are best, and yes, even which periodontists do it better. Data warehouses will soon allow us to compare one dentist to another, just as today we are able to compare physicians and hospitals. Our patients will take a more active role in their selection of their healthcare providers and their treatment in the future. They'll ask questions why. Those questions ask for comparisons, and this information will provide those answers.
And among the most prominent trends out there are two very clear ones. Patients are interested in wellness, not disease. They want to maintain and prolong wellness. And because of this, they are assuming